DFW is concentrating on strengthening its structure, consolidating its objectives, supporting and receiving support from clinicians, researchers, and academics, sharing our vision, mission, and values, as well as joining forces with like-minded medical associations. We invite you to be part of our family and help us with your donation to support our technological structure and interpreters. Finally, at DFW, we are convinced that only by dreaming big, working tirelessly, and staying focused, and working surrounded by valuable people like yourselves, we will achieve and exceed our goals. Thank you, thank you, thank you. Absolutely, all of our broadcasts have been free of charge. However, to maintain the digital services and to thank our team of interpreters in 5 different languages, we require your support, registration, inscriptions, and donation to the official DFW account shown on the slide. We remind you to switch off your microphones. Please switch off your microphones during all the session. There will be no live questions to our speakers, but you can interact with them throughout the chat box in 5 languages. You can write your questions to our speakers. To our keynote speakers today, we kindly remind you to keep track of your time with a maximum of total 45 minutes and a following 30 minutes round of question and answer session. We also remind you to speak as low as possible to allow our interpreters to translate properly. Now, it is my pleasure to introduce our Vice President, Dr. Susan Raj from India, who will give us a message. And it will be Dr. Raj herself who will be our Master of Ceremonies today and introduce our panel of speakers. Welcome, Dr. Susan Raj. As always, we're happy to have you. The microphone is yours.
Thank you very much, Rahul. And it is such a pleasure to be here once again with our eminent panelists. And my message to all those who are listening to us is that we all are working with a definition which will reach us to our desired destination. That is, health is an indicator of our behavior with our environment and restoration of self-healing system of ourselves. The 3 key words are behavior, environment, and self-healing system. Our cells are designed to detox. Our approach is holistic detox with integrative method at electromolecular level of the cells. Our behavior with environment will be seen in our health. Therefore, I call it as indicator. Today, we have our eminent speakers with us to show the path which they have paved to reach to the destination. Our destination is restoration of self-healing system of our cells. Integrating various paths to reach to this destination is the role played by Doctors Federation for the World, the DFW. Integration will also be extended towards the human behavior and environment, which stands for the soil, space, air, fire, and water. At the social structure, we understand that all the 3 functions of our cells, that is the electrical function, the mechanical function and the chemical functions of the cell by which our cell detox itself are directly connected to one and only profession called farming, from where food is produced. To maintain self-healing system of every cell, the cycle of the soil to stomach must be maintained. The economic system of entire humanity must be farming centered, where food, fuel, and fertilizer are the products which are permanently in demand. Therefore, Doctors Federation for the World invites experts from various fields to show their path to be integrated to achieve the sustainable health and economic system by modifying habits and the habitats of human. It is my pleasure to introduce our speakers today. Dr. Joseph James from USA. He is a medical professional with over 25 years of experience in the field. He graduated from Michigan State University in 1998 and specializes in regenerative medicine. Currently, he practices in Hollywood, Florida, and specialized in chronic disease prevention and management. Our eminent second speaker is Dr. Salahuddin Halasa from USA. He is a distinguished medical professional with extensive experience in various fields of medicine and research. His extensive clinical and research experience encompasses immunotherapy, stem cell therapy, laser therapy, and pain management. His work in the field of prevention and management of the chronic disease is eminent. It is once again my pleasure to invite both Dr. Joseph James and Dr. Salahuddin Halasa to present their subject today. Welcome, both of you. Thank you.
Hi. I wasn't prepared to give a specific lecture, but I'm happy to be here. I'm Dr. James Joseph.
Right, and Dr. Joseph, I will introduce you. I'm Dr. Halasa. I'm the founder of Chronic Disease Prevention and Management. Dr. Joseph is my partner. Yes, I'm prepared. And yes, I invited him to come and join me, and definitely he will be going through the slides with me. Yes, yeah, go ahead, Dr. Joseph. I'm sorry.
No problem. Dr. Halasa, can you please make your camera in such a position that we can see you a little more?
Okay, can you see me now?
No, a little more.
Oh, okay, here about. Let me see. Can you see me now? We're good?
Yes, yes.
Okay,
Now
good.
it is better. Thank you very much.
Right. And go ahead, Dr. Joseph. I'm sorry for interrupting you, just to make sure that we are prepared and we have our lectures here going. But yes, I did invite Dr. Joseph to be, he's my right hand, and he's one of the pioneer in chronic disease prevention and management. And we have 4 clinics in Hollywood, and we are practicing chronic disease prevention and management. Dr. Joseph is there, and he's taking care of the patients. So go ahead, Dr. Joseph. The mic is yours.
Okay. Just, whatever questions you might have as far as what I've learned or what's working. Is there any particular topic that you'd like me to speak about?
Dr. Joseph, I already gave them the lecture of chronic disease prevention and management. And what happened is that when I go through some slides, I will cover at least maybe 5 or 10 slides, and then you can cover the rest. So we can share the slides, and they can hear both of us. How about that?
That sounds great.
All right, great. Yes. All right. Can I have the sharing, because I cannot share my slides. It's disabled. I'm trying to
Yes,
share. Yeah.
Rahul can give you that. Yes, Rahul.
Let me find it.
Okay, got it. Yes.
Yeah, let me find it and I will share it.
I think I have it here. No, I have it. I have it. Can you see it? I just need the permission for the share. Can you see it now? Can
I
you see my
see it.
slides?
Yes,
Great.
we can see.
So
Okay.
basically, just a summary of how chronic disease comes about. When coronavirus hit, and most of the specialists failed to manage it because coronavirus infection is multisystemic diseases, and we end up coming up with this field of medicine. And it happened that the American Medical Association is working on the same field of medicine, which is chronic disease prevention and management, which addresses multi-systemic condition and disease like COVID-19. And then American Medical Association, they came up with a group, it's called CDPM. At the same time, we came up with our group, which is called CDPM-CS, which is Chronic Disease Prevention Management Centers, me and Dr. Joseph and Dr. Klatz, and we have around 10 doctors affiliate of this new field of medicine. And the American Medical Association group, they redefine the way we take history and physical exam. They call it 360 HP, which is redefining the history physical exam to include all the systems of the body when you take history to be more comprehensive. They call it 360 HP. We went farther and say, well, it's not just enough to redefine the history physical exam, but also we need to redefine the way we manage the patient and treat the patient. And we come up with those 4 pillars, which is the restoring and modulating the redox, the immune, the metabolic, and the regenerative status of the patient. So those are the 4 pillars. That's where the chronic disease prevention is based on. And so when we do any diagnosis or treatment, we consider those 4 things or 4 pillars, and we make sure that we take all the diagnoses based on those 4 pillars, and also we manage and restore the redox and metabolic and immune regenerative status in order to completely manage the patient with any chronic disease across all medical specialty. So this is the history of chronic disease prevention management. I just want to make sure that that everybody here knows that this is going to be a CME credited from American Medical Association. So you can obtain your credit, although the link is not being sent to me, but eventually they will. And once I get the link, I will be sharing it to all of you. And I think you can go ahead and distribute it to all your doctors there. So I will get you the link where you can click and obtain your CME. So this is going to be CME, Continuing Medical Association lecture with category 1 from American Medical Association. Because the lecture is a translation lecture, so I think it's fair for the translation. I can, to read through the slides in a state of explaining things. Maybe we'll explain it when we have the questions. But I think that's the best option to do, is to make it easy for the translation. So basically, I'm going to read the slides. And I think how many minutes that we can have? 30 minutes. I will do. Is that 30 minutes?
Yeah.
Can you hear me? Yeah, 30 minutes. Okay. So I'll do 15 minutes, and then I will have Dr. Joseph to finish up the other 15 minutes. So when it reaches 15 minutes, can you stop me so Dr. Joseph will take over? Are you there, Dr. Joseph? We good with this?
Yes.
Okay.
Yes.
So So basically introducing chronic disease prevention and management, and it's introducing this emerging medical specialty dedicated to the proactive approach in healthcare, which is chronic disease prevention and management. This field
Dr.
focuses on preemptive.
Dr. Halasa,
Yes.
could you speak a little slower?
Yeah. Okay.
The
Yeah. The
translator.
translation. Okay.
Yeah.
This field focuses on preemptive identification and intervention of chronic illnesses, offering a comprehensive strategy for managing long-term health conditions and enhancing patient outcomes. Chronic disease prevention and management represent a forward-thinking discipline that emphasizes sustained wellness through prevention, education, and patient-centered care. Chronic diseases are pervasive long-term health conditions that significantly impact morbidity, mortality, and quality of life globally. The World Health Organization report that chronic diseases are responsible for 71% of all deaths worldwide. These conditions, which include cardiovascular diseases, diabetes, cancer, chronic respiratory diseases, and mental disorders, are projected to see a 57% increase by 2026, I think. Despite their prevalence, chronic diseases are largely preventable and manageable through addressing modifiable risk factors such as tobacco use, unhealthy diets, physical inactivity, and harmful alcohol consumption. So what is the need for CDPM? Conventional medicine often falls short in addressing the root cause of chronic diseases, failing to provide care that is personalized and holistic. The gap had led to the emergence of a new medical specialty, chronic disease prevention and management, CDPM, is dedicated to developing diagnostic and therapeutic protocols aimed at preventing and managing chronic diseases by targeting the redox, metabolic, immune, and regenerative status of the patients. So the four key aspects of chronic disease prevention and management is number one, redox status, the balance of reactive oxygen and nitrogen species, crucial for cellular signaling, defense, and damage. Number two, metabolic status, the regulation of energy production and utilization, and the synthesis and degradation of biomolecules. Number three, the immune status, the activation and modulation of the immune responses, playing a role in inflammation, infection, and immunity. And number four, regenerative status, the maintenance and repair of cellular integrity and the differentiation and proliferation of the stem cells. These aspects are interconnected and influenced by genetic epigenetics, environmental, nutritional, behavioral, and psychosocial factors. CDPM employs a range of methods and tools, including biomarkers, genomics, proteomics, metabolomics, and epigenetics to assess and modulate these aspects of cellular function. Goals of CDPM. CDPM's primary objectives are the prevention and management of chronic diseases. Prevention involves identifying and modifying risk factors and promoting healthy behaviors before the onset of the disease. Management focuses on treating symptoms and improving the quality of life for those diagnosed with chronic diseases, and also treating the root cause of the disease. after identifying them. The chronic disease prevention management approach adapts a biophysical or biopsychosocial model integrating biological, psychological, social factors that affect the health. It emphasizes a patient-centered and a team-based approach involving a collaborative effort among various health professionals. This model also empowers patients and their families to participate in decision-making and self-management, supporting them in achieving their health goals. By addressing the multifaceted nature of chronic diseases, chronic disease prevention and management aims to enhance the prevention and management strategies, ultimately improving patient outcomes and quality of life. The Chronic Disease Prevention Management Center's Continuing Medical Education Fellowship Program, I will let Dr. Joseph to go ahead with to finish this. Dr. Joseph, are you there? I think I got my 10 minutes, right? Dr. Joseph, are you there?
Yes, right here.
So can you continue here?
Yeah, so I'm just going to read from the slide here, and then I'll just make some comments. So obviously there's a demand for health services and the increasing expenses that are involved with chronic disease management. It's very important for doctors to undergo training. We have to relearn medicine, especially in the United States. The American doctors are taught medicine a certain way, but in my experience, I had to learn new things, especially through Dr. Halasa. I had to understand redox medicine. And what I mean by redox medicine is I had to understand oxidative stress at a cellular level much deeper than I learned through conventional medical education. The other thing is that I had to think about disease differently. The old way of thinking didn't work for these conditions. These conditions are very complicated. Like Dr. Halasa said, they are multi-systemic. I mean, you have, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 different things going on at the same time, all causing dysfunction within the cell. And that's where the thinking is we're thinking at the cellular level. But Dr. Halasa's education is structured very nicely because it helps to focus on a few things sort of at the top of the pyramid. Okay, you understand? In order to organize the thinking of, well, where do we start? Okay, you have this going on, you have that going on, you have that going on, you have that going on. That's how the doctors get confused. So if you relax, you say, okay, we have a dysregulation in oxidative stress. I mean, it's very basic understanding. There's too many free radicals. The cells cannot neutralize those free radicals. So one of our big goals is to, as Dr. Halasa says, buffer the redox. And this is the language of the literature. I mean, this is how the laboratory science explains it. Then there's the immune status. You have immune dysregulation. You have one part of the immune system going in this direction. Your T cells are going in this direction. Your B cells are going in this direction. There is immunodeficiency. And we have to try to create balance because we know that chronic inflammation and immune dysregulation can lead to worsening of the chronic disease, degeneration, premature aging, and cancer. And so the education is teaching us, excuse me, somebody is trying to.
Okay, so I think he got disconnected. So I'll continue here until he comes back. So yes, basically we came up with a fellowship program for the doctors to understand this field of medicine. And it is CME fellowship, and we have weekly webinars for that. And definitely we would like to work with the Word organization, which is your organization, to see if we can join forces here. And this fellowship program represent cutting edge medical field dedicated to the creation of diagnostic and treatment protocol. These protocols aim to prevent and control chronic illnesses by adjusting the patient's immune, redox, metabolic, and regenerative systems. He's back now. Are you back, Dr. Joseph? Chronic disease is defined as a condition persisting for a year or more, necessitate continuous medical care, and may restrict daily activities. In the United States, these diseases are predominantly cause of mortality and disability, and they contribute to the 90% of the country's 3.8 trillion in annual health care costs.
I'm
Are you
back.
there?
Yeah, sorry.
I'm just filling up the gap there. Go ahead.
Okay, good. This is why we work together. By the way, we have fun with learning, by the way, but we are also very serious about innovating new ways to treat patients, focusing on the most important things. But back to what I was saying, and I'll keep this short and understandable, is that the thinking of chronic disease is organized into oxidative stress or buffering the redox. We need to restore immune balance. In order to do that, we have to understand the immune system deeply. We have to understand immunodeficiency. We have to understand what Th1, Th2 dominance, Th17 dominance. We have to know the language. This is the language that the doctors are not learning. And each of these tells us a story of what's happening inside the body. The third, and obviously there are pathogens that are leading to this dysfunction, and in my experience, there's multiple pathogens that are being activated after having COVID, after having immune deficiency, and those have to be addressed, because if we do not keep these pathogens under control, they will take over the body, and we will not be able to help these people, including ourselves. The third thing is metabolic. We have to have thyroid hormones, cortisol. We have to have sex hormones in balance. But this is where Dr. Halasa has come up with a new brilliant way to see hormones, to simplify it. We have to think philosophically here. When we're growing up until age 50, the sex hormones are not just for reproduction, they are helping to keep inflammation under control. They are anti-inflammatory. And we have more sex hormones than cortisol. So you think sex hormones, cortisol, okay, it's like this: more sex hormones, less cortisol. And this is good because the sex hormones are reducing the inflammation, creating a healthy immune system. But after 50, it switches and we become cortisol dominant, which makes sense when you think about it. The big aha is that cortisol is degenerative. Okay, sex hormones are regenerative. So there is a balance there that if we can make that balance, that makes a big difference. Instead of focusing on too many things at once, we can focus on the big picture. That's the way I like to go about it. It makes it easier. And then after those three things are in balance, then we can focus on regeneration, different tools to regenerate. I have lots of experience with stem cell regenerative medicine, peptide therapies, and even there's a new class of peptides that are much more powerful that I have used, that we have to continue to improve the tools that we have to regenerate the body, because the degeneration of the body, the issues that we're dealing with, they're getting worse and worse and worse and worse. And so we have to have better and better and better strategies. But to summarize Dr. Halasa's lecture, is that first thing is to redefine what's going on and redefine how we think about the diseases, understanding that they can be very complicated if you do not have an organized way to think about the disease in the first place. And like the first speaker said, to restore the functions inside of the cells, to produce energy, and to restore ultimately body balance. Thank you.
I think we're good with time, or we still have time to continue the slides? Or you want to go to the questions and answers, whatever you want.
Yeah.
Yeah,
let's. I think just maybe if anybody has questions, because I think we made the point clear.
Yeah, that's up to them. If they want me to continue with the slides, I can continue with the slides reading, because they are translating and we have to be slow and all that stuff. So, and the translation, for them, it's better to, they think it's better to read through the slides and translate to make it easy for them. But it's up to you. If you want to continue with the slide, I'll try to be slow there. If not, we can do the questions and QA.
We have 10 minutes.
10 minutes for reading through the slides. We can do that?
Yes.
Okay,
Yes.
good. Just let me know so that we can, I can stop, because when I go, I just have to put breaks there. So anyway, so I'll go through the slides, and it's talking about the fellowship program. Given the escalating demand for health services and increasing expenses associated with chronic disease management, it's crucial that physicians undergo thorough training. The training should enable them to be effectively manage chronic diseases at different stages, fostering teamwork and cost efficiently in patient care. The CDP-MCS CME Fellowship Program is designed to provide physicians and healthcare practitioners with advanced training in prevention and management of chronic diseases. It integrates both traditional and alternative diagnostic and therapeutic approaches. The curriculum encompasses 15 key learning objectives, spanning the spectrum of chronic disease education, including conditions like diabetes, cardiovascular diseases, cancer, and chronic pain management. Participants will gain practical experience in innovative treatments, including nanomedicine, cosmetic intervention, energy-based therapy, and regenerative medicine. Education and resources are delivered through a variety of formats, weekly webinars, extensive literature library, dictated private chat group, which I think the same thing you're doing here with Dr. Fanny and her fine groups of doctors. Our chief presentation references materials, direct in-person training sessions, and opportunity for public speaking and training engagement. I think the same thing. We are having the same common thing, and joining forces, it's a good thing because that will add more value to what we are doing, both of us. This comprehensive approach ensures that the healthcare professionals are well equipped with contemporary knowledge and practical skills necessary to address the complexity of chronic diseases effectively. The management of chronic diseases is a primary focus in all areas of medical practice. However, the conventional history and physical diagnostic and therapeutic protocols have remained static and do not adequately address the conditions. To bridge this gap, the CDP-MCS has introduced innovative history, physical exam, and diagnosis and treatment protocols. So we redefine the whole thing from not just the history physical exam, which the other group and CDPM, part of the AMA, they redefined taking history exam his history physical exam to be more comprehensive and including all the systems of the body, involving all the social economic factors that affect the patient. We also redefine the way we treat and diagnose the patients. So it's HPDT in a state of 360 HP only. Tailored together comprehensive psychosocial information, and these protocols are designed to identify the social and fundamental determinants determinants impacting health, prevent and manage chronic illness more effectively by influencing the immune, the redox, metabolic, and regenerative. And we call this IRMR status, which stands for immune, redox, metabolic, regenerative. So we went farther to what the AMA did with their group, which is redefining the history physical exam. We redefined diagnosis and treatment based on modulating and restoring the IRMR, which is immune, redox, metabolic, and regenerative status of the patient. The IRMR status represents an integrated and holistic view of the patient's health, encapsulating the intricate interplay between the immune system, redox equilibrium, metabolic process, and the body capacity for regeneration. Factors such as genetics, lifestyle choices, environmental exposure, infection, toxin, stress, and aging process can all modify by the IRMR status. This in turn influences an individual vulnerability to chronic diseases as well as their progressive and progression and prognosis. Consequently, the Chronic Disease Prevention Management Center's HPDT, which is History, Physics, Exam, Diagnosis, and Treatment Protocols, are strategically aimed at evaluating and enhancing the IRMR status through a personalized, evidence-informed approach with ultimate goal of improving patients' outcome in chronic disease management. The management of chronic disease is a major component of healthcare across various specialties. However, the conventional history, physical, diagnostic, and therapeutic protocols are outdated and insufficient for these needs. To address this gap, the chronic disease prevention management care system has innovated in new HPDT, and these protocols are tailored together I think we repeat this already. The IRMR status is subject to influence from multitude of factors, including genetic, lifestyle, choices, environmental exposure, infection, toxins, and natural aging and process. And I think we did this slides already. The Chronic Disease Prevention Management CME Fellowship Program is, we already did this, I think, right? Oh, no. It's structured into 15 comprehensive modules, each focusing on critical aspects of chronic disease prevention management. Here is our organized and rephrased overview of the modules. And we have the module number 1, patient evaluation and strategy. I will just go through the headlines. Number 2 is significance of gut health. And number 3 is comprehensive strategy in immunotherapy, allergen identification, and tolerance induction. Those are the models. And number 4, environmental toxins and chronic disease. Number 5 is latent infection. Those are the modules that we are discussing in our fellowship program. Number 6, metabolic health and chronic disease prevention and management. Number 7, cancer prevention and management in chronic diseases. Number 8, anti-aging strategies in chronic disease management. Number 9, practical nanomedicine workshop. And number 10 is cosmetic procedure training. And number 11, energy therapies and redox therapies in chronic disease management. And number 12, regenerative medicine and ultrasound guided intervention techniques. And number 13, management of centralized and peripheral pain overview. And number 14, therapeutic use of peptides in medicine. And number 15, compliance with regulation and ethical standards in anti-aging, regenerative medicine, stem cell therapy. So those are the 15 modules. These are the reference, and I think we conclude the lecture of today. Thank you very much for having me here, and having me and Dr. Juice, of course. Any questions?
Dr. Rash, would you like to start? Dr. Yamashita?
Yes, Dr. Halasa, thank you very much for your presentation. And it's a great pleasure to see that there are other doctors working with this kind of medicine that we are struggling here to communicate to the whole world. And I think it's a very important work you are doing. And we would like to help to communicate to the whole world to participate in these programs. And I, including myself, I am very interested. And my question is, this program, any doctor from any country in the world can participate.
Yes, any doctors, and you also can earn the CME from American Medical Association. We can provide it. It's up to your board in your country. They will accept it and give you credit for it. But any doctors who are practicing, this is kind of a specialty, which is after you become a specialist for, let's say, for pain or for neurology or for gastro, and you want to have kind of another medical specialty that is more comprehensive, that include all chronic disease across all medical specialties, which I encourage all the specialists to become chronic disease prevention management and join this fellowships. Then I think they can have better understanding of the way we manage chronic diseases, more comprehensive than the tunnel vision that we do when we are specialists.
Yes, congratulations. I agree that the old medicine cannot help to prevent and to treat in a satisfiable way. And so we need new approaches in medicine. So it's very interesting, your approaches. are very advanced and integrated. And so I think everybody should know it, and let's help to communicate this. And I would like to know if there is any kind of traduction, interpretation for other languages, or it is only in English.
That's a
Well,
great question, by the way, Dr. Halasa, maybe we can answer this one together because we have a medical language translator, one of the best in the world within our group.
Oh, very good.
I'm talking about Dr. Halasa,
Sheldon, yeah.
Sheldon.
Yes.
Yeah, they are doing translation. They've been doing medical translation, and I'm talking about expert translation, because they have to be very particular with the meaning between this language and that language, and so we probably have the best in the world to help with this translation.
The other option, the other thing that I'm working on is to write a book on chronic disease prevention and management. I already, did a lot, and I use AI to make things easy. So I'm using the technology. But that book, if we come up with a textbook together, then we can translate with different languages. But those just slides that we have here, I can expand it better, and possibly we can come up with 100-page book, and then we can this slides that we have here. It's very valuable, and we can just expand it, organize it, and perfect it, and then print it down in the form of a book, and then translate it. I think 100-page will be a good introduction, and then until the textbook of 1,000 pages is out. But I think that's my idea now, is just this 47 slides, or how much of 50 slides. We can just expand it and come up with 100 pages, and then translate in different language. I think Sheldon will help me in doing that. At least you can have this information as a hands-on or handbook for all translation. That makes it easy to get the message through all different language.
Okay, I have another question. Um, the program is only available for medicine doctors. I am a medicine doctor from Brazil, but I think many people from other countries are therapists or nurses or other professionals that would have interest.
Yes, I think it's a new medical specialty that cover all chronic disease across all medical specialties. It involves also all the technical part of doing those procedures, and I think having other healthcare providers, whether you are a nurse or you are a physical therapist, understanding the concept and the process, it's very important. So because there's a lot of things can be translated into technical, where we need to have technical expertise and skills being done by the physician assistant and nurses. Like, for example, when they do photomedicine, I think that the nurses can do the procedures instead of doctor. So there's things that in this field where it involve other healthcare providers, which is the med level, not just the MDs. And I think I like to have the staff to be educated about the program, and so they can be actively involved, intellectually involved in taking care of the patients. So yes, I think it cover nurses, physician assistant, physical therapist, because redox medicine is, I mean, that's in everybody, I think, as a medical doctor. We never hear about redox medicine. It's only an academy here in Utah, which is a bunch of PhDs. They are trying to translate it to clinical, but they have a problem with that. Um, but there is an academy for redox medicine, and that field, it's not in our curriculum, and that needs to be integrated in our curriculum. Regenerative medicine, for example, it's not yet in our metabolic medicine. We are doing it, but we're doing it pharmaceutical, and instead of doing it more of holistic and nutraceutical. And our it's very limited to those metabolic, 6 hormone restoring 6 hormones. We never, we're not, it's not yet in the mainstream medicine. um a lot of things that we are teaching here, it's not yet written in the main curriculum of medicine, which we need to do that, and start injecting those information so that the students, they will be more familiar about this field of medicine, and more um, realistic in managing chronic diseases, because the way that the mainstream medicine is doing it is they are failing, because all this big pharma product does not, most of the time with long-term use, they compromise the mitochondria. And when you compromise and they're not friendly with mitochondria, you induce oxidative stress, and that's where all the side effects comes about. But natural products, it's more compatible with mitochondria. So in chronic disease, we try to replace the man-made products into natural product as much as we can.
Yeah, that's a great point to say, because yes, we are medical doctors, but we understand too that really it's the natural medicines, herbal medicines, the plant alkaloids are I call it the old medicine is actually the best medicine. But there's a place in between that, because these diseases are very advanced. Sometimes the inflammation is so much that if we can replace the prescription medication, expensive prescription medication, with sometimes the older medications from the 1950s, 1970s, we repurpose them. When we look at the literature, we find out many of these medications are coming from natural sources, but they have been forgotten about, they've been suppressed, and we have been repurposing these medications, small molecules. They are more natural, less side effects, in order to help somebody to go from here to maybe they still need something strong, less side effects, ultimately to all natural or as close to natural herbal diet control. But we have to understand it's not just this or this. We need to understand how to move from this kind of medicine over to the natural medicine, and then we find that there's these plant alkaloids in between that can be very powerful and effective.
Thank you very much. How do you have it? Would you like to make that question that you written?
Yes, sure. Dr. Dr. Paula Gordon from Washington, USA asked, please comment on approaches to addressing the problem of spike proteins that result from COVID infection and from the use of COVID mRNA vaccine and boosters. What is your view of the effects of prophylactic and therapeutic use of green tea and baobab powder? So they are two questions. One is, how do you handle these patients resulting from COVID infections and long COVID? And the second one, if any comment related to prophylactic and therapeutic use of green tea and baobab powder.
Okay, let me answer, and then Dr. Joseph will add more to it. It's very important when we manage any diseases, we don't shoot in the dark. We need to understand the pathophysiology in detail.
Great.
And that's what we are missing in medicine, is that we are just following whatever is being sent by the CEO of the big pharma. and that's it. And anything out of that, it's it's fake, according to what we learned from the past experience. And I think everybody relate to that. Um, but as doctors, we come up with the plan and protocols based on the pathophysiology of the diseases, and we use anything it takes to navigate the pathophysiology and restore it back to normal, without waiting for the CEO or for those people to tell us what to do. And we use both sides of the aisle, whether it is integrative or whether it's conventional medicine. We don't have any restriction of using both, as long as it fits very well with the pathophysiology. Now, pathophysiology of COVID, which I have a very big lecture on it, those spike protein blocks the ACE receptors. Everybody knows ACE receptor. It's part of angiotensin renin system, angiotensin converting enzyme. It's part of angiotensin renin system. And angiotensin renin system in our body is not just controlling your blood pressure. That's what we learn in medical school. We think it's only controlling the blood pressure. But we find out it's not just controlling the blood pressure, it also controls your immune status. And so the angiotensin converting enzyme type 2, this enzyme converts angiotensin 2 to angiotensin 1,7. And what it does, angiotensin 2, this angiotensin 2, it is increasing the blood pressure, yes, but also it decreases inflammation. Angiotensin 2, it increases the immune, and it increases the status of your immune reaction. In other words, it boosts the immune system. That's angiotensin 2. But when you convert it to angiotensin 1,7 by angiotensin converting enzyme type 2, it turned it into angiotensin 1,7. Angiotensin 1,7, it is an antioxidant, and it is an anti-inflammatory arm of the renin-angiotensin system. So we have two arms of the renin-angiotensin system. We have one that is causing inflammation and boosting the immune system, which is angiotensin 2. And then we have the angiotensin 1,7, which is antioxidant and anti-inflammatory arm of your immune system. And so if you block ACE2, then you're not converting any more angiotensin 2 to angiotensin 1,7, and then you have too much of angiotensin 2 that will activate the angiotensin 2 type 1 receptors. And activating angiotensin 2 type 1 receptors over excessive amount will lead to signaling of the immune system to increase inflammation, specifically the Th17 immune, which leads to neutrophilia and increase in interleukin 6. And so it polarized the immune system into Th17 and neutrophilia. And it fools the immune system because we have a viral attack, but the immune system reacts to it as it is bacteria. So in a state of polarizing the immune system into Th1, it polarized the immune system into Th17, neutrophilia, and excessive amount of inflammation, and that leads to all this multi-systemic organ failure and COVID. But also it fools the immune system, it polarizes the immune system away from Th1. Right.
Dr. Halasa, I want to jump in. I don't mean to interrupt. If you could, because he's asking a specific question about the green tea and the other supplements.
Yes, but I
what
to...
are we doing?
Right.
I understand them, because this is why it takes a long time for us to learn this information. It's a new language, right, and this might be new for them. So, what specifically are we doing based on our knowledge? We're not shooting in the dark. Like, for example, I brought in the idea that we may want to add a nicotinic receptor agonist, okay, something that is a plant alkaloid. This is a different mechanism of the spike protein to protect our nicotinic receptors in our brain, in our vagus nerve, and in the peripheral nervous system. That is natural plant alkaloid that protects those the regulation of the autonomic nervous system. That's an example of one way to protect against the spike protein because it may be antagonizing our nicotinic receptors. That's something that I've worked on with you, that we're working on together. So a plant alkaloid, specific plant alkaloids is what we are working on for that specific function.
Right.
Without shooting in the dark.
Right. There is two pathology that involve the spike. One is the nicotinic receptor. The other one is ACE2. But the nicotinic receptor is not recognized by the medical community like 100%, like they're 10%. 90% of the medical community understand ACE2, and the spikes blocks the ACE2. And so I'm going with this, and then we're going to speak with nicotinic. But let me just finish up this so we can understand why we're giving the tea extract and all those things. So we understand that the spike protein, when it blocks the ACE2, it leads to immune system depolarize the Th17 and interleukin-6, and you end up with neutrophilic hyperinflammation that destroy the whole blood vessels and lungs and make the lung become fragile. And so there's two way of managing COVID and even post-COVID. One is to decrease inflammation, the Th17 mediated inflammation, right? And the second one is to block the spike protein from attacking the ACE2 receptor. Those are two things that we need to do. And the tea extract does inhibit the inflammation, the Th17 inflammation. And all those polyphenols that you talked about, it does help to decrease the Th17 inflammation. Still, we need to have something that combines with the spike protein. Ivermectin combines with the spike protein, prevent it from attacking or inhibiting the ACE2. That's a good thing. Plus, ivermectin inhibits the Th17 inflammation. Methylene blue does block the spike protein and inhibit the Th17 inflammation. All those polyphenols, including those teas and all that, it helps to inhibit the inflammation. But still, you need something to block the spike protein. That's why we use methylene blue and ivermectin. I hope that I did explain the pathophysiology, and then I come up with the right explanation of the mechanism of action of the drugs and how they work. Does that make sense?
Yes, yes. Dr. Halasa and Dr. Joseph, the interpreters are asking to speak a little slower.
Lower. Okay, I'm sorry for that. The Americans, they speak very fast. The English people, they speak slow. But because of the passion and that's the reason. I will try my best to be slow as I can. But again, I think I did explain that there's two aspects of managing COVID disease is blocking the spike protein. Ivermectin, methylene blue does that. And the other part is inhibiting the inflammation using polyphenols, which is tea extract. What other things you can say? Curcumin, all those things that inhibit the Th17 inflammation and the interleukin-6 mediated inflammation and neutrophilia. All of this it's part of the as an anti-inflammatory. So I hope that answered that specific questions. And if you go to the vaccine is also the same thing. It's a spike protein, right? Because they express the spike protein. And that's the problem I have with the vaccine. If they can create a vaccine that does not express the spike protein, that would be great, because that's the whole problem. Why? Because the spike protein is a pathogenic. And that's led to something in the United States group. There's some group they call spikeopathy. And the vaccine, if they can create a vaccine without the vaccine expressing the spike, that will be a great vaccine. Plus a vaccine that produces spike, and we know the spike leads to skewing the immune system into Th17 and instead of Th1 and cytotoxic T cells, then those vaccines are not giving you a balanced immune system. They are giving you imbalanced one, where there is too much of memory Th17. And the Th17 and neutrophilia will not really eliminate the virus. You really need Th1 and cytotoxic T cells. So where's my problem with the vaccine is those vaccines are not producing balanced immune system. And the reason because of the spike is hijacking the renin-angiotensin system, leading to skewing the immune system and the memory of the vaccine into the wrong direction. So I wish that we have a vaccine that leads to balance of the immune system, I will be entertaining it, regardless of its RNA or whatever, it doesn't matter for me. And it does not produce a pathogenic spike protein, because that's the reason why we have all this problem. And when you counter the infection again, your immune system, instead of giving you a balanced immune system, giving you Th1 and cytotoxic T cells to clear those cells from the virus, they are giving you excessive of Th17 and interleukin-6 and neutrophils. Neutrophils cannot eliminate the virus. It's good for bacteria. And so that's the reason we end up with all the side effects from the vaccine, because of excessive inflammation that's coming from the vaccine. And from encountering this infection again, they are giving you a wrong inflammation, not inflammation that cleared the virus, but excessive inflammation that leads to destruction of your blood vessels and in your lung tissue, and well, this multisystemic and all the side effects that we hear about it. It makes sense?
Yeah. Thank you, Dr. Halasa. Dr. Rash, would you kindly give us some words, some comments? Dr. Susan Rash? Oh, okay. It looks like Dr. Rash is not available. Dr. Yamashita, some other questions?
No, for me, it's all right. I am very satisfied with the explanations, and congratulations again for you all.
Yeah,
Right.
let me say one thing. Even if you did not understand everything that Dr. Halasa said, I think you can understand that he knows what he's talking about,
Sure. Yeah, sure.
right? I hope we can at least smile at that one, and laugh about that one. He knows, he understands, he really does know what he's talking about. And I learned from him, and that allows me to bring new ideas, and to think about things in the right way, to not guess and, oh, try this, try that, or nah, it's healthy. No, we are targeting things specifically. We understand what's going on. We understand the science. We translate the literature. We take the medical literature. We know. I know for a fact, from my experience, they're not giving us the answers directly in the medical literature. You understand what I'm saying? They're not giving it to us, but the answers are there. If we use intuition, we have to read between the lines. I love to read literature now. And I used to. I didn't like to read the scientific literature so much, but now that I understand the language that Dr. Halasa is talking about, the redox language, now I can think. I can connect the dots, and with those connections comes the innovations, the new ideas that are working better than even the new ideas that we had 2 years ago, a year ago. We are getting better and better results, but we are constantly innovating and translating the literature and finding new ideas. So that's what I want to say.
Thank you, Dr. Joseph. Dr. Susan Rash?
Yes, I think it was so well explained, and it is nice to have you both. And Doctors Federation for the World stands for every method that works to detox our cells, because I always say that cells are designed to detox, and it is our responsibility to maintain this capacity. Fantastic. Thank you very much for bringing your experiences and sharing with Doctors Federation for the World. So yes, Rahul, so we can end the today's meeting.
Yeah, sure. Just one last reflection. Dr. Halasa, would you like to give us a final thought, a final take-home message to everyone?
Yes, but before that, because I can see Dr. Rachi likes detoxing, and I just want to give her a good news that
Great.
we have a problem with detoxing fat-soluble toxins. And I think you know that. The mycotoxins, the organophosphorus, all these petrochemicals that's stored in fat tissue. And we don't have any effective chelation for it, except sweating and sauna. But we have the water-soluble toxins, that heavy metals, using activated charcoal, EDTA, that's a good thing. But we don't have any fat-soluble detox, effective ones.
Right.
Recently, we came up with a fat-soluble detox, and I'm gonna have a lecture, which I really think I did present it, and I have recorded one with CME. It's the cyclodextrin, and the cyclodextrin is gonna be a big thing as fat-soluble toxins, as mycotoxin detox, all this petrochemical, all this organophosphorus. And I would like to have that personal discussion with you, because I can see you're more of environmental detox, and we can definitely move this field of medicine with understanding that there is something now. It's a good news. It's a happy news for every doctor who understands the meaning of detox, to have something that detox the fat soluble toxin. So that's something I would like to have a personal talk about it. Regarding the coronavirus infection and COVID and the spike protein and all these things, I think we talked about methylene blue and ivermectin and all this polyphenols and vitamin D, health optimization, 6-hormone, all of this help in combating this condition, and also the post-COVID-19. Also, there's mast cell activation syndrome that comes along with spike protein, because of spike activate the mast cells as well. So there is medication for that, and possibly we can come up with a lecture for that. For chronic disease prevention and management and treatment, this is one of the problems that we have in mainstream medicine. They did very good in managing acute conditions, but when it comes to chronic diseases, I think the way that we are doing it's more effective, more comprehensive, and American Medical Association does encouraging us to really add more to the curriculum and the fellowship. If you go to their website, it's called AMA CDPM, and they are asking us to develop this field of medicine. They already have a group, it's called CDPM Group of AMA, but I think our group here, we can join forces, and we can even perfect this field of medicine along with my partners, which is Dr. Joseph. And I think Dr. Joseph want to say something, and I think I conclude the lecture here. But
Yes.
Dr. Joseph,
Yes.
the mic is yours.
Yeah, beautiful, beautiful. Thank you. And I agree with the detoxing, by the way. In fact, everything I'm doing I'm trying to detox everything. I'm breathing, drinking, eating, everything. I'm trying to help my body to detox, because this is ridiculous what's happening. I understand when you say detoxification, that yes, we have to constantly enhance our body's ability to detox, and these heavy metals, and then this and that, and it's coming from everywhere. So yes, 100%, we have to have detoxing strategies, helping our body to detox as they come in. They can leave and go out of our body, because that's a big deal. So thank you.
Thank you, Dr. Halasa. Thank you, Dr. James. Today we had the opportunity to have a short journey throughout a very interesting way of handling preventing chronic diseases. And this is called CDPM from their creators. And it consists in 4 key aspects, such as redox status, metabolic status, immune status, and regenerative status. That is all related to detoxification. So thank you, both of you, Dr. Halasa, Dr. James, for being here today. We close our session by stressing our need for your support. Absolutely all our broadcasts have been free of charge. However, in order to maintain the digital service, Zoom, storage capacity, internet, power supply, website, etc., and to pay or retribute to our team of interpreters in 5 languages, we require support, registration, and donation to the official DFW account shown on this slide. Let me share this slide now. Here. And yeah. So a big thank to our team of translators and interpreters, without whom this forest loses its strength, intercultural and international diffusions. From English to Portuguese, Valeria Gauss from Brazil and Selene from Brazil. Doris Rodriguez from Brazil and Valentina, I think she didn't make it, from UK. From English to Italian, Fabiana Mendes from Brazil and Lulia Daniela Negru from Belgium. From English to French, Beatrice Duty from Switzerland. And unfortunately, Mohamed Basri couldn't make it, from Morocco. Additional thanks to our team of supporters, such as Maria Fernanda Uribe from Mexico, Frida Rosas, Vivian Freitas from Paraguay, and Patricia Gawa from Peru, from their immense help in our everyday organization. They represent a new generation of professionals committed from a very, very young age to their communities and world's population. And of course, they are a source of pride to us. Be sure to visit us in our social medias, Facebook, Twitter, Instagram, and LinkedIn, and our website, www.doctorsfederationfortheworld.org, for some information on how to become an active member, more news and benefits. If you like this session, we strongly encourage you to become a member and help us throughout your donations. You can make a screenshot and help us continue our DFW mission. On behalf of all of us at DFW, the steering committee, staff, and translators with interpreters, we thank you for your presence and questions at this session, and we wish you a wonderful weekend. Greetings from a lot of countries worldwide: Argentina, Peru, Mexico, India, Costa Rica, Brazil, Bolivia, Switzerland, USA, Morocco, Libya, of course, Guatemala, Bolivia, and visitors from different continents. See you next time. Thank you, and have a nice weekend.
Thank you very much. Good night.
Thank you.
Thank you. Thank you. Bye-bye.
Bye-bye.